Hello everyone. So I came across this rather interesting quiz on one of the sites I mess around on, and it was dealing with the American Healthcare Act. It was a quiz, and I started going into it, and I found it interesting, and I decided to make a video as I took the rest of it. I only answered 3 questions of like the first 3 questions, and what I was getting was quite interesting. How true a lot of this stuff is, I don't know. So I'm just going to go ahead and start taking the quiz, but first there's an introduction to it. It says American Healthcare Act HCA quiz. I'll put the link for it in the description. On May 4th, 2017, the House of Representatives approved the American Healthcare Act AHCA legislation to repeal and replace the Affordable Care Act ACA. On May 24th, the Congressional Budget Office scored the latest version of this bill. Do you think you're an expert on the AHCA? I don't think I'm an expert. I've been hearing it's really bad. I've been hearing that people are going to lose their health care coverage and all of that sort of thing. And I'm not really sure what's going on with it. But do you think you're an expert on the AHCA? No, I don't. I think I'm rather non-knowledgeable about it. I've just heard what the media's been saying. Take this quiz to test your knowledge. Alright, so I'm going to click the Get Started. And the first question is American Healthcare Act AHCA quiz. There are 10 questions. Number 1. Under the AHCA, the individual mandate tax penalty is repealed effective as of what date? January 1st, 2016, January 1st, 2017, January 1st, 2018, or date of enactment, or I don't know. Actually, what I was hearing was it was going to start in 2018. And that's the answer I put, so I'm just going to click that. And it says wrong, gives you red X, and it says the correct answer was January 1st, 2016. The bill will repeal the individual mandate retroactively to tax years beginning in 2016. That means for all those people that got charged because they weren't on insurance, what I've heard is some of those charges were like $1,000 in taxes or something like that. You're going to be getting that money back. That's what it sounds like. I might be reading that wrong, but that's what it sounds like. Alright, next. American Healthcare Act AHC. Sorry, that's not the thing. The second question. True or false? Under the AHCA, anyone with a pre-existing condition would be charged a higher premium if they buy insurance on their own. First answer is true, second answer is false, and the third answer is I don't know. I'm going to think that from what I've been hearing in the internet, or hearing on in the news and the media, that it's terrible, and that is in fact true. So I'm going to put true. Oh, look at that. I've been lied to by the media. The correct answer was false. Insurers would only be allowed to charge higher premiums to people with pre-existing conditions in states that receive a community rating waiver, and then only for people buying individual health insurance who have had a breakage in coverage. So it sounds like it's up to the states on this one. So if you're in a shitty state that wants to screw you, and you have pre-existing conditions, guess what? You're going to be paying more. Now, I wouldn't blame the federal government for that. I'd blame the damn state you're in, and the representatives who probably should be voted out if they actually have that whatever community rating waiver. I have no idea what that is. Okay, next. 3. How would current... Oh, this is a long one. Alright, how would current law premium tax credits for individual health insurance be charged under the AHCA? First answer is starting in 2018, the amount of the premium tax credit would be increased for individuals with income over 150% FPL who are younger than 50, and decreased for individuals with income over 150 FPL who are age 50 and older. Next answer, starting January 1st, 2020, the ACA premium tax credits would be repealed. And on the third answer, starting January 1st, 2020, new flat premium tax credits based on age, $2,000 per year for individuals younger than 30, $4,000 per year for individuals 60 or older, would be available to individual market participants subject to an income cap, or all of the above. And then the next one is don't know. Having taken multiple choice questions with the feds, if there isn't all of the above, guess what you do? You click all of the above. The only reason I got that right is because that's how multiple choice questions and Fed tests work. And I did get that answer right. You are correct. During 2018 and 2019, current tax credits would be modified to increase the amounts of younger people, and beginning in 2020, existing tax credits would be repealed and replaced with age-based ones. I don't really know what that's all about, but okay. Alright, number 4. Under the Affordable Health Care Act, insurers offer marketplace plans with reduced cost sharing, e.g. lower deductibles and co-pays to people with income up to 250% FPL. How would the AHCA change these cost sharing reductions for individual health insurance? Starting in 2018, cost sharing reductions would be extended to individual policies sold outside of a marketplace. Answer 2, starting in 2020, cost sharing reductions would be limited to individuals earning 150 FPL. I don't know what this FPL thing is, so I'm kind of lost on this. I probably will have to look this up. By the way, I'm taking this test for the first time now with the camera going. The ACA cost sharing reductions would be repealed starting in 2020. Okay, the cost sharing reductions. I think that's what Obamacare is. It's kind of like the marketplace. So you buy insurance, and then the government subsidizes you an amount to help you with the insurance. And actually, that's a great help for me, because otherwise I'd be paying almost $300 a month, and that's too much. That's too much for insurance I'm being forced to have. Alright, so I'm going to say starting in 2020, cost sharing reductions would be limited to individuals earning 150% or less. And that's incorrect. The correct answer was the ACA cost sharing reductions would be repealed starting in 2020. The AHCA repeals the cost sharing reductions as of January 1st, 2020. So that's kind of bad, but at the same time, if they reduce the cost of healthcare in general, that might not be that bad. I mean, I'm paying $300 and I have $6,000 deductible and no dental, no vision, just basic care. And it's like, that's not acceptable. That sucks. I've always said, in order for me to use my health insurance, I might have to take out a damn loan, before it kicks in, because I have to pay at least $6,000 before my health insurance kicks in. At least that's how I understand it. I've heard people having even more deductibles, and the idea of the deductible in itself is just aggravating, just very aggravating. Alright, number 5, true or false? The AHCA guarantees coverage of the 10 essential health benefits established by the ACA for all individuals and small group market health insurance policies. I think it'll be the same. I'm going to say true, and it's false. The correct answer was false. Beginning in 2020, the AHCA permits states to waiver the 10 essential health benefits. Waiver states could specify a different benefit standard for insurance policies offered in the individual or small market group markets. Okay. I'll be honest, I have no idea what they're talking about there. It sounds like a bunch of gobbledygook to me. If anybody knows what the heck that is, please explain, and I'll say mea culpa. I'm dumb when it comes to this. Alright, number 6. According to the Congressional Budget Office, CBO, under which measure would more young adults, 19 to 29, be uninsured? The ACA or the AHCA? I'm going to say the new one. I'm going to say the AHCA, because you're not going to be required to have health insurance. Let's find out. I am correct. You are correct. CBO estimates that the uninsured rate for all ages, including young adults, would increase substantially under AHCA relative to current law. That's because the current law requires you to be insured. And also, I heard in the news that these so-called uninsured are people who are below a certain coverage. Like my coverage, I would be uninsured under that, because I'd be considered uninsured, because plans that have high deductibles and low coverage, they're not really considering as coverage. That's what the CBO is doing. That's at least what I heard in the news. Makes sense too, because yeah, essentially I'm not covered. Alright, number 7, the AHCA changes coverage provided to low-income adults through the ACA's expansion of the medical program by mandating that all states adopt a Medicaid expansion. Second answer, ending the enhanced federal funding for the expansion population. Third answer, eliminating the Medicaid expansion as a state option. Or I don't know. I'm going to go ahead and say I don't know, because I don't know. Gee, don't know is the wrong answer. It gives you X on that one. The correct answer was ending the enhanced federal funding for the expansion population. While the AHCA retains the state option to expand Medicaid eligibility to adults up to 138% of poverty, it ends enhanced federal funding, match funding, that finances this coverage. As a result of this and other changes to Medicaid, CBO estimates 14 million fewer people will be covered by Medicaid in 2026. That's not all that great, but yeah, I don't know about that. Number 8, true or false, the AHCA provides less Medicaid funding to states to support coverage for children, poor seniors, and people with disabilities. I'm going to say true from what I've been hearing in the news. Oh, look at that. You are correct. The CBO estimates that the states would receive 24% less in federal Medicaid funding compared to current law in 2026. Yeah. Number 9. True or false? The AHCA does not make any changes affecting Medicare, the federal insurance program for seniors and some people with disabilities. I think it's going to change things. I'm going to say true. Good. The correct answer was actually false. The AHCA would retain virtually all Medicaid care provisions that were included in the ACA, but repealed 0.9% Medicare payroll surtax on high-income earners. On high-income earners. Oh, okay, so us low-income earners are going to be paying for Medicare. Okay. Next, and number 10. The AHCA cuts federal tax revenue by $992 billion over 10 years to achieve overall savings. The bill reduces federal health spending by $1.11 trillion over 10 years. Over 70% of the federal spending cuts are achieved by which of the following? First, repealing ACA small employer tax credits. 2, replacing ACA minimum premium tax credits with new flat tax credits for non-group coverage. 3, repealing ACA cost-sharing subsidies. 4, converting federal Medicaid payments to a block grant or per capita cap and phasing out enhanced funding for the Medicaid expansion. Good Lord. 5, rescinding unobligated balances under the Federal Prevention and Public Fund. I have no idea what the fuck they're talking about there. Let's go say don't know. Wrong. The correct answer was the converting federal Medicaid payments to a block grant or per capita cap and phasing out enhanced funding for the Medicaid expansion. The bulk of federal spending reductions in the AHCA come from converting federal Medicaid payments to a block grant or per capita cap and phasing out enhanced funding for the Medicaid expansion. I'm going to stop there. This test was interesting. Some of the things I've been hearing in the media has been, kind of exaggerated, but a lot of his stuff was gobbledygook to me. And I'm sure it's a gobbledygook to a lot of people. The bottom line is this. The United States needs to do away with for-profit healthcare systems. It is ridiculous that we still have this system. I mean, for-profit healthcare is essentially a middleman between you and your doctor. And this needs to stop. I mean, maybe in this case socialism is actually a good idea when it comes to healthcare, because it's absolutely ludicrous. We have these companies that are publicly traded, which means they have CEOs, they have executives, they have shareholders, they have all this stuff that doesn't do anything. The money that you pay into your healthcare is going into a pool that's supposed to be distributed for people that are on the plan or on the plans of that healthcare company. Not into the pockets of the executives, not into the pockets of the shareholders, not into the pockets of the CEOs. But that's what's happening for a lot of things. And this is healthcare. This is people's lives and well-being we're talking about. This isn't like a product or a widget or something like that. And I've always felt like this about healthcare insurance. First of all, insurance in general raises the cost of everything. It just makes money more available, and that way people can charge more for their services. And now what's happening with the healthcare providers is doctors are getting screwed. They're getting screwed, and just people in general are getting screwed. And if you make below a certain amount, you can't afford healthcare insurance. Me being forced to take this healthcare through the Obamacare system was actually painful until I saw that I was getting subsidized. And the fact I'm getting subsidized is depressing, because that money is subsidizing my healthcare, but that money is government money going into the pockets of the healthcare insurance, healthcare companies and their CEOs and all of that. Yes, some of the money does go into a pool, and it is distributed to the people who are on the healthcare plans of that company, but a chunk of it goes towards something that doesn't do anything for health. They're not doing anything. And so, and don't give me this shit of that's the way the American, that's capitalism for you. There's some things where capitalism needs to take a fucking back seat. When it comes to healthcare, it needs to take a back seat. Because we're talking about people's lives. Now, if you think I'm some liberal libtard or something like that for saying that, I'm not the only one who thinks like this. There's a lot of people who think that we should just have single payer or government healthcare like all other civilized nations. Like Japan has a single payer kind of health system. It may not be single payer. Norway, up until the mess that they're in now, they had it. Germany, all those countries had a form of single-payer healthcare, and we are the only ones who don't. For crying out loud, Israel has got it, and guess who's paying for that, by the way? So I think it's time for healthcare insurance companies to be for-profit healthcare companies to be abolished. I don't know how else other people think, but that's my stance. So there we go. That was the quiz. I will give you the link to that quiz, and hopefully things improve, and these sorts of things won't be an issue anymore. Have a good day.